Good afternoon, everyone. My name is David DaCosta. I'm with parkbench.com and Harcourt's Prime Properties Realtors. And I want to introduce our special guest this afternoon, Tina Buchanan. Tina is the owner and founder of Visionary Care Consultants. So hello there, Tina, on the verge of
Hi,
this
thank
new
you
year,
for having
2021.
me.
Welcome, glad to have you. So
Yes,
let's start right off with telling us a little bit about who are you and how did you get into this business of visionary
sure.
care?
Yes, thanks for asking. So my name is Tina Buchanan. I am a medical social worker by training, and I have been working with the aging now for 15 years. And how did I get into this business? It was a long process of me going through school, trying to figure out what I wanted to do. And I quickly realized once I was in my master's program that I wanted to work with older adults and make a difference for our community, specifically our older adults and disabled adults. And so about 4 years ago, I went out on my own and started Visionary Care Consultants after working in several skilled nursing facilities in San Diego and being in the community as a home health social worker. I said, why not go out on my own and do it myself?
Perfect. Well, we're glad to have you in the industry. And
Thank you.
so, can you tell us in a little bit of detail what kind of services does Visionary Care provide to the elderly?
Sure. So Visionary Care is a concierge care management group, and we are a group of nurses and master's level social workers, also mental health workers that help the aging population navigate the complexities and the challenges that come along with aging. So it can be anything from attending doctor's appointments with them and then reporting back to their power of attorney or a family member about what their prognosis is. It could be coordinating home care for them to make sure they have someone in there to help them get dressed with bathing. It could be navigating, maybe they're going through a really difficult diagnosis of cancer or a new treatment that they want to try, and they have 15 doctors that need to coordinate services, and they need someone to be that quarterback. We act as a quarterback for the family. So for my gentlemen in the room, I usually say, we're your quarterback and we tell you what to do and where to go. For our women, we say we become that in-town daughter who, for a lot of our clients, our families live out of town or they are just busy working themselves and maybe raising children, the sandwich generation, and they need someone to help mom or dad or grandma and grandpa. And we become that extra daughter and that extra person that they can count on to give them advice, help them put the right pieces in place. It's a puzzle out there, and we put the puzzle
Wow.
pieces together to make sure it fits.
What a playbook. What a playbook. And I thought I had challenges in my industry. Uh,
Mhm.
Real quick, to kind of dovetail on all that wealth and plethora of service
Mhm.
to a very unique and special community, what have you noticed? I mean, with the COVID times that we live in?
We have noticed that our business has actually, we've gotten a lot busier because families are now in a position where they can't visit their loved ones. Maybe they're in a nursing home and they can't get in, they're locked out. They live all over the country and they used to fly back and forth to take mom to the doctor's appointments, and they're not doing that anymore. Even our in-town families that need help, they are looking at their parents differently, or their grandparents or their aunts or uncles through this pandemic and saying, I want to keep my mom safe. What do I need to do in order to do that? So we've actually seen a huge increase in our business because seniors are at the forefront of this pandemic and everyone wants to make sure they're safe, healthy, happy. But we've also noticed that they do want to keep them, they want to make sure they're still getting that medical attention that they need, and they need answers. that sometimes they can't get by just calling the nursing home and saying, how's my mom today? They're not getting the answers.
And I
And
would imagine the mental
yeah,
stimulation as well to keep their
correct.
attitude strong.
Correct. So we just created a program during the pandemic, actually, called Thoughtful Engagement. And that program came because of the idea of these seniors being so isolated. They still need engagement. The people that are not engaged are suffering from depression. They're suffering from more physical health. They are having, panic attacks, all of these other things that are happening because they are so isolated. That program within Visionary Care is designed to make sure that they can still engage safely, either virtually or in person, one-on-one with someone, and so that their mental health is still intact, because
Well,
that has hugely been impacted by the pandemic.
this is great. And I just want to thank you. I know our time is limited because you are on such a tight schedule, and we really appreciate your time, Tina. But before you go, I know you work primarily in Carlsbad and North County and so on, but how do we get a hold of you? I mean, we're going to put you up on our parkbench.com/Carlsbad website. So you'll be seen there, and we can upload this video. It'll be up there in a couple of days, hopefully this year, on the brink of going into 2021.
Yeah.
But yeah, how do we get a hold of you? What's your contact info, your website, and so on?
So our website is www.visionarycaresd, like San Diego.com. You can also reach out to us directly. We do a free consultation at 619-228-3584. And any one of our staff members can just talk to you about what's happening, and we can tell you how we might be able to help.
So they can just call in, check in. You can talk about insurance plans that are accepted or not accepted, and so on and so forth.
Correct.
Well, great.
Yep, absolutely free call. So give us a call. Go to our website. Check us
Myself
out.
in real estate, being a senior real estate specialist, I work a lot with older clients as well. So I know I've referred you in the past, and I will continue to do so. But thank you for doing what you do and being such a valuable resource in our community. And I want to wish you, take this moment, and your entire family and all of Visionary Care Consultants a blessed, healthy, and prosperous 2021.
You as well. Thanks for having us.
Thank you so much, Tina. Take care now.
Okay. Thank you. Bye-bye.
Bye-bye.